Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for Extract 1. Extract 1. Questions 1 to 12.
Dr. Steve Saunders interviewing Janet Cooper, grandmother of Riley Cooper, a patient with a recent problem.
For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Well, there are several ways we can manage this condition, and I'd like to discuss them with you now. Okay, firstly, you should monitor his food. Limit the number of eggs that he eats. That would be a good start.
Yes, we can do that.
Okay, now at bath time, I recommend using lukewarm baths or showers using non-soap cleansers such as Sorbolene or a non-medicated variety of soap.
Well, you get that from the chemist, I guess.
Yes, absolutely. There's a variety of products available, so go and talk to your pharmacist about that. And now, after the shower, it's a good idea not to rub the skin. Rather, just do a gentle patting of the skin with a soft towel, and this can make a real difference. And after you've done that, generally within a few minutes, it's a good idea to apply moisturizer, because what that will do is lock in the moisture.
Would that be like Sorbolene or something like that?
Well, Sorbolene is possible, or vitamin E cream, that kind of thing.
Yeah, right.
Because what we're trying to do here is stop the skin from drying out. So by locking in that moisture, he's going to feel better and the itching is going to reduce. Also, I said a lukewarm bath because hot showers or anything that can cause a rapid change in temperature, or things that might even cause Riley to sweat, are going to make the condition worse.
Yes, I can see that.
So also, in the house, as we have a very hot climate here in Brisbane, we need to make sure that the living environment is well ventilated.
Oh, well, we have fans, and of course in summer we leave the windows open and things like that.
Well, that's great. Fans certainly are really good because that keeps the air circulating and that can help. Now, regarding clothing, I really recommend that he wears 100% cotton or similar soft fabric. Just avoid the woolen products and, some of the polyester products, because particularly if they are rough or scratchy fibres, they will irritate the skin. Tight clothing can also aggravate the skin, so loose clothing is much better for him.
Yes, well, he likes loose clothing.
Well, that's really good. Now, you mentioned Riley had a pet dog.
Yes, he loves that dog.
Well, look, for the time being, and I know it won't be easy, but I would recommend keeping the pet outside.
Right.
And, just making sure that there aren't any excessive amounts of animal hairs in the house.
Well, we can certainly try that. It might be a bit difficult, but we'll give it a try.
That's good. You mentioned he has quite a few stuffed toys.
Yes, he does.
Well, I would, for the moment, quarantine those toys and put them in a box out of the way. Just for a while, just to see if it makes a difference.
Right.
And make sure that you change the bed linen regularly.
Oh, we do that.
But I've been doing it as much as 2 or 3 times a week at least. That will make a difference, particularly in the summertime. Also, there are specialised dust mite prevention covers that are available in department stores.
Oh, we could look into that.
All of these things are going to help limit the condition and make Riley's life a little bit more comfortable.
But what about medication? Are there any really good medications that will clear it up?
Yeah, well, there are a variety of ways and treatments available, and it does depend on the actual severity of the condition. We use topical cortisone cream, and that can help reduce the inflammation and itchiness.
Mm-hmm.
This is also the most common form of eczema treatment, and it is available on prescription. There are some milder strengths that are available in the pharmacy, and in severe cases, we can use sedating antihistamines that induce sleep and reduce itchiness. So if he does have trouble sleeping, then using that is an option.
Right.
If the scratching becomes severe and he does develop infections that are secondary to the condition, then we can use antibiotics and wet bandaging that can soothe the skin.
Mm-hmm.
It also reduces the itchiness and helps to heal these lesions. However, at this stage, as you said, he hasn't had any infections, so we're not really looking at that. It's also possible to do some allergy testing to establish the actual trigger factors, but I'd like to begin with this monitoring and these measures that we've spoken about so far.
Extract 2. Questions 13 to 24.
Here, Dr. Dorothy Sims interviewing Mrs. Black, a parent of a child with a current problem.
For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Level.
Oh, she does work hard on her ballet, Doctor, but apart from that, she doesn't do much at all and tends to lie on her bed a lot of the time.
And what about her weight? How's that?
Well, I think she's really lost quite a bit of weight. She won't tell me, of course, but she is always weighing herself and standing in front of the mirror.
I see. And how about her sleeping habits? Does she have a good night's sleep every night?
Well, frankly, I don't think she's sleeping that well, as she seems to stay up very late at night. And then, of course, she'll be tired and moody in the morning.
Has she ever complained of headaches or dizziness?
Yes, she does seem to get a few headaches. And apparently she fainted at school, but she denies that.
And has she had or suffered from any constipation?
Yes, she's very secretive about that. But I have noticed that she's taken laxatives once or twice.
And what about her periods? Do you know if they're regular?
Oh, well, I'm really not sure about that. She doesn't tell me. From what I've told you, do you think she has anorexia?
Well, without meeting her and assessing her, which I think I will need to do, it's hard to make that judgment. However, I can tell you a little bit more about anorexia if you'd like.
That would be very helpful.
Well, firstly, there are 2 types of anorexia. The first is what we call restricting type, which is where young girls like your daughter try to lose weight by restricting their calorie intake. They may exercise at extreme levels or go on drastic diets or fasts to lose weight.
Well, she seems to have some of those characteristics.
The other type is what we call the purging type, and that's where people tend to get rid of calories they've consumed by vomiting or using laxatives.
I have suspected that she has thrown up, but she denies it.
Well, now, anorexia is most common in adolescent girls, with typical age of onset being between 13 and 20. So your daughter is in the high-risk age group.
I see, and I'm sure this is dangerous.
Yes, there can be severe physical effects. For example, frequent cramps, easy bruising, anemia, pale skin due to low iron levels, as well as strain on the body organs. So it's really important to treat the condition as soon as possible.
Well, Doctor, what can we do to treat her?
Well, there are some options available, but the main aim is always to increase weight back to the normal level. But this can be very difficult.
Yes, well, she won't listen to us and she's very sensitive about her weight.
Well, there is a service known as nutritional counselling where a dietitian will work with your daughter and talk to her about healthy eating, proper nutrition, and about the importance of eating balanced meals.
Yes, I think it would be better to come from a professional rather than a family member.
Yes, and they will also help them to follow meal plans that have enough calories to reach and maintain a healthy body weight.
I see.
And a second option is psychological counselling. And the goal here is to identify the negative thoughts and feelings about weight that are behind these behaviours.
Yes.
And to introduce healthier and more positive attitudes. And, of course, build her self-esteem.
Right, well, she needs that.
Now, there are further options available, but as a first step, I think I need to see your daughter sooner rather than later.
Okay, well, I will talk to my husband and we'll get in touch with you very soon.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Today, what's in the mind of your pet dog? This is what Gregory Burns wanted to find out about his dog.
Now read the question.
He decided to investigate by scanning the brain of his pet dog, Callie, in an MRI machine.
Well, initially when I started this project, it really was just a side project. So for most of my career, I'd spent roughly 20 years actually studying human brains and how humans respond to various things like incentives and risks and rewards. And the dog project just started as a crazy idea of first asking the question, could I train my dog to go in an MRI scanner so I could see what she was thinking? And initially, I didn't really have kind of any expectations that it would even work. We weren't sure that we could train a dog to do this, that we could do it in a way that they would like. And in fact, it turned out to be not too difficult. It only took a few months to train my dog. And it kind of exploded from there. We started with 2 dogs, and actually just this last week, we successfully scanned the 100th dog.
So to have an MRI is quite a traumatic thing in a lot of ways. It's very noisy and you have to go into a closed space and you have to be very still. Just give me a sense of how you trained these dogs.
Question 26.
Seligman discussed his work over a period of many years on the character traits of optimism and pessimism and how they determine people's resilience in life. He investigated whether you could change pessimists into optimists, and if so, could you prevent depression?
Now read the question.
Not depressed at this point. We identified pessimistic kids and optimistic kids. And we took the pessimistic kids and we took the techniques of cognitive therapy, which Tim Beck had developed with Al Ellis at that time, and we taught them prophylactically to 10 to 12-year-olds. That is, what we did was, first, if you're a pessimistic 11-year-old girl and you're in the cafeteria sitting there and all of your friends walk by you and go to another table, the first thing you do is you catastrophize about it. You think, I'm a reject, I'm unlovable, pervasive, permanent, uncontrollable. So the first thing we teach you is to recognize.
Question 27.
It's one of US neuroscientist David Eagleman's favourite areas of research.
Now read the question.
Yeah, synesthesia is something that about 3% of the population has, and it's a blending of the senses. So you might look at letters of an alphabet and see colors when you look at that, as well as seeing the letter on the page. Or you might hear a piece of music, and as well as hearing it, you experience colors or shapes visually. Or you might put a piece of food in your mouth and you feel something on your fingertips. Or you might touch something and it causes a sound for you. It's this blending of the senses like that. And it used to be thought it was very rare. We now know that quite a large percentage of the population has it, 3%. And there are many different flavors of it. And what it represents is, instead of having strict borders between brain areas, between the activity and the information in those brain areas, there's just a little bit of, it's like a porous border, like two countries with a porous border where there's some amount of traffic going back and forth between them. And we don't think about this as a disease or a disorder. It's just it's an alternative way that people can experience the world.
Question 28.
Professor Valsamma Eapen, Chair of Infant, Child and Adolescent Psychiatry at the University of New South Wales, defines the condition.
Now read the question.
Happen.
Could some of the type of tics be related to something that's happened in the past for people? Can it be related to perhaps what experiences the child's been through?
I don't think it has got a direct relationship in terms of the type of tic, but anybody who is under stress or has had difficulties in life would definitely have an exacerbation of tics. So when you are under stress, it's known that tics get worse. So it may be that those kind of circumstances may have an additive effect or a compounding effect on the tic so that it becomes more prominent or becomes severe in a particular point in time, but not as necessarily to the type of tic.
Valsa Eapen.
No.
Question 29.
Neuroscientist Dr. Sarah Mackay has studied how our brains are shaped and changed by our lives, genes, hormones and society. She became particularly interested in women's brains when she was writing an article about so-called brain fog, reported by some women during menopause.
Now read the question.
Yeah, that is one of the reasons why, and that was something that surprised me when I first started delving into the literature. Yes, there are lots of longitudinal studies that have been designed to look at the lifespan of women, but when we look to some of the research, such as clinical trials, we know that the majority of them have traditionally been done in young, healthy, fit males, and there's a number of reasons for that. Some of that's just tradition. We just kind of carry on doing the same research and using the same subjects that we've always done because it's just easier that way. Sometimes women have been excluded, perhaps if a woman fell pregnant during a drug trial, that could be, for obvious reasons, could be incredibly damaging to her health and to the health of the baby. So women have been excluded for those reasons. There's also some really interesting reasons that women have been excluded from some of the neuro.
Question 30.
Research Fellow at the University of New South Wales Faculty of Medicine. Young.
I think one of the key things is if you think back to when you were 16, 17, 18 years old, there's so much going on at that time developmentally. It's a really turbulent and sometimes chaotic time in itself. Young people are striving towards independence. There's, career and schooling goals going on. They're working out their identity. The peer group is becoming more and more important, and they're sort of moving away from their parents. And of course, there's all of those things to do with sexuality emerging, romantic relationships. And so to throw a cancer diagnosis into that, it's a bit of a double whammy in terms of the challenges that brings up. Young people often have to become a lot more dependent on their parents again when they've otherwise been moving towards independence. I'm a clinical psychologist as well, so thinking from a psychological perspective, the other thing that we know is going on at that time is that it's the peak time of onset for mental health disorders generally, so things like anxiety, depression. And so having a cancer diagnosis come in at that.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Now look at Extract 1. Extract 1, questions 31 to 36.
E. Attention Deficit Hyperactivity Disorder.
You now have 90 seconds to read questions 31 to 36.
What are the symptoms of ADHD? Most kids could be described at some point as inattentive, impulsive, or hyperactive. Explanations for this behaviour vary widely, ranging from the child being overtired to overexcited. However, when such behaviour lasts for significant periods of time, and when it interferes with life at school and at home, the explanation may be due to a condition such as attention deficit hyperactivity disorder, or ADHD. Some studies suggest that about 2% of primary school-aged children have ADHD, while others have suggested that almost 18% have ADHD. However, the majority of researchers put the figure at between 5% and 10%. Regarding gender, boys are at least 4 times more likely to be diagnosed with ADHD than girls. Prenatal risks. Some studies have shown a possible increase in risk among children whose mothers used cigarettes or alcohol during pregnancy. Therefore, if you are pregnant, do not smoke or use alcohol. Environmental toxins. Exposure to very high levels of lead before age 6 or so might also raise a child's risk. Some young children are exposed to lead from the dust of worn paint in many older buildings, or from drinking water that has travelled through lead pipes. Family history. Having a biological parent or sibling with ADHD seems to raise a child's chances of developing it. According to the National Institute of Mental Health, at least 1/3 of fathers who had ADHD in their youth may have a child with ADHD. For some children who have ADHD, some foods, such as sugar and food colourings, seem to trigger more out-of-control behaviour. But food is not a trigger for many children with ADHD. Being at a party often triggers out-of-control behaviour, which might be due to foods, but the behaviour is more likely to be due to too much excitement. Sleep apnea, blocking of the airway during sleep, is linked to problem behaviours in many children. Some research has shown that about 30% of children who have ADHD have some sleep apnea. Signs of sleep apnea include snoring, often loud snoring, and stopping breathing for a brief time during sleep. Not all children who snore have sleep apnea, but if a child with ADHD also snores, this might be part of the problem. Despite at least 40 years of research worldwide, there is still no clear explanation for why ADHD happens in some children. More recent theories suggest that there is a problem with how the front part of the brain works. This causes the child's brain to deal with information and feelings in a different way from other children. It is comprised of 3 core symptom categories, which are hyperactivity, poor concentration, and impulsiveness. In order to reach an accurate diagnosis, the presence and pattern of development of symptoms in each of these categories must be considered. Hyperactivity. Children always seem to be on the go or constantly in motion. Hyperactive behaviour may be demonstrated by a difficulty in playing quietly, excessive fidgeting, continuous talking, restlessness, inability to sit still when required, poor concentration. Children have a hard time keeping their minds on any one thing and may quickly become bored with the task. Signs that a child is inattentive include disorganisation, poor academic performance, being distracted easily, forgetfulness, losing things, and poor completion of tasks. Impulsiveness. Children seem unable to curb their immediate reactions or think before they act. Impulsive behaviour may be identified through disruptive behaviours in the classroom, such as interrupting other children, poor turn-taking, blurting out answers before they are appropriate, rejection by their peers and classmates, as well as accidental injury. How ADHD can affect young people. People with ADHD may not do as well at school as they are capable of because it is so hard to concentrate and stay still. In addition, schoolwork gets harder as you get older, and it may become more and more difficult to keep up with the work. Furthermore, if no one knows they have ADHD, it may mean that they do not get the special help they need. As they get older, they are expected to take more responsibility for their own learning and behaviour, and to be more organised in order to do this. This can be hard with ADHD. For young people who are not able to plan and organise themselves, for example, they don't hear the teacher's instructions, they lose assignments and homework, school gets very difficult. This can result in poor marks, being kept back in lower grades, lower self-esteem and confidence, as well as regular truancy.
Now look at Extract 2. Extract 2, questions 37 to 42.
In this part of the test, you will hear a talk based on an essay published by the Public Library of Open Science on the topic of seasonal hunger.
You now have 90 seconds to read questions 37 to 42.
Most of the world's acute hunger and undernutrition occurs not in conflicts and natural disasters, but in the annual hunger season. This is a time of year that is characterized by a lack of stored food from last year's harvest, high food prices, and lack of jobs. Nearly 7 out of 10 hungry people in the world, or about 600 million in total, are either landless rural labourers or members of small farm households. Many of these 600 million people live in areas where water or temperature constraints allow only one crop harvest per year. Their poverty is driven by seasonal cycles, worsening especially in the pre-harvest months. During this hunger season period, household food stocks from the last harvest begin to run out. This is due to low production levels, inadequate storage facilities, and accumulated debt. These factors all combine to force families to sell or consume their agricultural production well before the new harvest. In many poor rural communities, the majority of families are affected, so mutual support networks are undermined. And because of general shortages of food supply at the local economy level, food prices on the open market increase considerably during the hunger season. These families are trapped in a hunger pattern that occurs every year. At the same time, labour markets are flooded with hungry families who come to town seeking work. Even for those lucky enough to find employment, wages are low, and working for wages to obtain food for immediate needs forces the farmers to neglect their own farm, which in turn will compromise future harvests. The net result is that households are forced to reduce the diversity and quantity of food they consume, setting the stage for macro and micronutrient deficiencies. In addition, to further compound the problems, pre-harvest hunger season is also often the rainy season, a time when malaria, diarrhea, and other illnesses strike. The psychological effects of these struggles are profound, as family members often experience elevated levels of anxiety and stress in the hunger season. Women are especially affected, as their responsibilities often include both earning an income and caring for infants and children. In summary, the combination of all these challenges at specific times of year generate seasonal patterns of hunger and undernutrition. However, I'd like to say that seasonal hunger is not inevitable. Governments across the world have experimented with a wide variety of policies that have proven successful in combating seasonal hunger. 3 important strategies that have been designed to reduce suffering and help families are emergency assistance measures, which are targeted at people who are suffering from severe or acute hunger and those that need immediate help. A second strategy is the social protection safety net, which attempts to prevent vulnerable families from falling into hunger. This is done by providing a mixture of food price regulation, employment opportunities, and nutrition programs. Finally, rural livelihoods development interventions focus on improving productivity through better access to productive inputs such as fertilizers and water. 5. The community-based management of acute malnutrition approach, also known as CMAM, is revolutionizing the treatment of severe acute malnutrition among preschool children. Most severe acute malnutrition, a condition which can kill in weeks if not treated, occurs not in emergency situations of conflict and natural disaster as one might think, but rather in contexts of extreme poverty, and particularly during the annual hunger season in rural areas. Traditionally, children suffering from severe acute malnutrition have often been treated in hospital-type inpatient settings. However, very high per-patient costs and staffing needs under this approach, as well as a lack of appropriate and modern facilities in many rural areas, mean that only a limited number of undernourished children are fortunate enough to receive this treatment. The CMAM approach addresses these issues by mobilizing communities themselves, with the assistance of frontline health workers to identify and treat the 80% or so of severely and acutely undernourished children who do not have other illnesses or complications. The use of easy-to-administer therapeutic foods, such as nutrient-dense, ready-to-use foods, make this community-based strategy affordable. Meanwhile, inpatient care in therapeutic feeding centres can concentrate on the remaining 20% of undernourished children who do not have complications.
That is the end of Part C. You now have 2 minutes to check your answers. That is the end of the listening test.